authors and creators of this video allowed Dr. Adair to record and use this video as an educational tool.
Subjects are healthy women between the ages of 18 and 30 who did not complete 3 or more aerobic exercise sessions per week for the last 4 weeks. The methods used for this study are as follows. The research was set up as a prospective study using pre- and post-test control group design. The research is a single-blinded, randomized control trial with convenience sampling. The independent variable for the study is aerobic exercise and visual imagery. The dependent variable will be a change in anxiety levels as indicated by a modified version of the clinically useful anxiety outcome measure and modified global anxiety visual analog scale. Stay tuned and we'll tell you our inclusion and exclusion criteria.
The inclusion criteria for the study included healthy females ages 18 to 30 with mild to moderate anxiety based on the Beck Anxiety Inventory. Additionally, each participant had to respond no to each question on the Physical Activity Readiness Questionnaire. The exclusion criteria for the study included the presence of a current diagnosis of anxiety disorder or depression, current medication use for anxiety, depression, mood, personality, and/or dissociative disorders, currently receiving counseling services for anxiety or depression, presence of cardiopulmonary conditions including but not limited to diabetes, anemia, sickle cell disease, heart murmurs, DVT, pulmonary embolism, stroke, and/or high blood pressure. Any pre-existing musculoskeletal conditions, including bone fractures, ligament tears, or surgery, especially in the past 6 months. Current and consistent participation in regular exercise defined as 3 or more times per week for the past 4 weeks. Current use of visual imagery. Suspicion of pregnancy or currently pregnant. And lastly, vision or hearing impaired without corrective equipment.
The recruitment period for the study was between May 2014 and December 2014. We contacted various departments at Dominican College via phone, email, or in person and provided a link so they could share with their students at any point in the year. Other ways of contacting participants was through social media via Facebook, where a link was provided to a SurveyMonkey questionnaire to determine whether they could continue to phase 2 of the study. Once participants were determined to qualify for Phase 2, an email was sent for an invitation to participate at a specific time and date and location. With this email, there was also a packet provided for health and safety education and the informed consent for participants to review. And that was the conclusion of our recruitment period.
The intervention. Both groups exercised for 20 minutes, including a 5-minute warm-up and cool-down. Prior to initiation of treatment, and at 0 and 10 minutes post-treatment, blood pressure, heart rate, respiratory rate were taken. Participants exercised between 60 and 80% of their heart rate max, which was determined by this formula. In 2-minute intervals, the Borg rate of perceived exertion and heart rate were asked to ensure participants were exercising within their target range and safely progressing. The aerobic exercise with visual imagery group, in addition to the stretching protocol, had an audio recording guiding them through visual imagery and stretching.
The outcome measures used for the study included the Beck Anxiety Inventory, Physical Activity Readiness Questionnaire, a modified version of the clinically useful anxiety outcome measure, and a modified global anxiety visual analog scale. A pre-test post-test control group design was implemented, in which the modified version of the clinically useful anxiety outcome measure and the modified global anxiety visual analog scale was administered at baseline and after the stretching period. Statistical analysis of the data collected will be analyzed through the use of statistical package for the social sciences. An alpha level of 0.05 is set to confirm statistical significance of the study. Since the number of participants in each group was less than 30 for the study, nonparametric statistical analysis with Mann-Whitney U-test will be used to analyze the data. The research hypothesis is that there will be a significant difference between the aerobic exercise group and the aerobic exercise with visual imagery group.
Now it's time for our SWOT analysis. First off, the strengths. Number 1, there are already many high-quality studies supporting the use of aerobic exercise and visual imagery on anxiety when used alone. Also, the protocol for each participant was almost identical during the treatment sessions. Each researcher also maintained the same role for each participant. The study is single-blinded. It's also a pilot study that it will be used to determine the feasibility of the type of the study, and there were even amounts of participants in each group. Next, the weaknesses. We had a small sample size. We used self-reported questionnaires, and we also had to use 2 different research facilities. The opportunities we have, there is a large pool of data from the survey on SurveyMonkey, which we could use to collect additional data points from. And lastly, our threats. We had a small sample size, and again, we had to use 2 different research facilities.
The researchers of the study would like to thank Dr. Adair and Dr. Olson for their expertise and guidance throughout the year while the study was being conducted. Thank you.